Now, the first primary nephritic type of glomerular disease that we'll take a look at is IgA Glomerulopathy or IgA nephropathy, all the same thing. AKA Berger, what I wish to bring to your attention is there's another condition in pathology that we call Buerger's disease. And Buerger's disease is going to be associated with small vessel disease or vasculitis. Completely different discussion. That's point number one. Many students tend to get that confused between Buerger's and Buerger's. They're two different conditions. One has nothing to do with the other. Berger has to be dealing with IgA. This IgA is then going to deposit, I'll tell you in a second, but before I get there, this IgA could also be found in another important disease. That is an important differential that could also be associated with the kidney. Do you remember which one? What if I told you there's IgA deposition in the kidney or in the glomeruli, and there's also palpable purpura in a young child in the lower extremities or perhaps the buttocks? That's called Henoch-Schönlein purpura, and a better name now clinically, and has been for quite some time, called IgA vasculopathy. Are we clear? Be careful. This is only nephropathy. Berger, most common nephropathy worldwide, meaning to say majority of nephritic and also, take a look, nephrotic, 5% of the time. So worldwide, this is the one that you definitely want to know. Next, affects children and adults. Next, increased mucosal synthesis and decreased clearance of IgA. Thus, you'll find 50% of your population in which the IgA levels are elevated in the serum. Next, there's focal proliferative glomerulopathy. This IgA is then going to deposit on your mesangium. Let me ask you something. So therefore, which one of the biopsy patterns would most come in handy here, do you think? It would be the immunofluorescence in which in the mesangium you find green pools. Meaning to say immunoglobulin is accumulating in the mesangium, resulting in green pool type of deposition. So mesangium IgA is what you're paying attention to. These immune complexes deposit with the granular immunofluorescence. It ends up being in the mesangium. You're going to activate the complement pathway. Complement, the alternative. Overlapping features with Henoch-Schönlein purpura may occur, but the difference is with IgA here and Henoch-Schönlein, you pay attention to purpura and HSP. Henoch-Schönlein, the purpura representing involvement of your blood vessel. In Berger, that is not the case. But in HSP, could you involve the blood vessel and the kidney? Yes, you can. What's immunoglobulin? AAA. Episodic bouts of hematuria. I need you to pay attention to the description, episodic. That is big in medicine. You can have episodic type of events with hypertension. That's pheochromocytoma. You could have episodic events of jaundice. That's Gilbert or Gilbert syndrome. You have episodic bouts of hematuria. High on the differential, you should be thinking about IgA nephropathy. Usually following a upper respiratory tract infection. Highlight that in your head. Hyper or upper respiratory tract type of infection, you don't have this latent period. For example, say that you had sore throat or pharyngitis, 2 to 4 weeks later, that would not be Berger. 2 to 4 weeks later would be PSGN with hematuria. If we're talking days after a sore throat or pharyngitis, that would be Berger IgA nephropathy. Did you hear what I just said and how important it is, based on that history, to come up with two differentials and which one will be a more likely differential if you had what's known as synpharyngitic. Synpharyngitic basically means days after a pharyngitic episode, upper respiratory tract infection, your patient now has developed hematuria. Slow progression to chronic renal failure. Only 40-50% of the time, but it's slow progression. Many times you can have kidney damage, not necessarily going into chronic renal failure. Corticosteroids decrease proteinuria, treat the hypertension, what you must do. Remember, especially if it's a child, these are things that you want to keep in mind.